Hello and welcome back to another Minute in the Clouds with Greg. And this is kind of sort of day 19.5. And it's understanding secondary traumatic brain injury. What is secondary traumatic brain injury? Well, I'll discuss that today. Most people have heard the term traumatic brain injury, and you often imagine severe accidents, high impact events, but it's not widely known about is the concept of secondary TBI. Secondary TBI can be just as debilitating, if not more so, than its primary counterpart. And TBI is a very complex injury, and it presents a wide range of symptoms and disabilities. The impact on individuals can vary very greatly depending upon how severe the injury is, the location of the injury, and TBI can be categorized based on the mechanism of this injury and how severe. So, Emitted in the Clouds with Greg, day 19.5. I jokingly say 19.5 because yesterday I decided that I'd take a break and not broadcast or write an article. So this is technically day 19, but if I would have done yesterday, it would have been day 20. So if you haven't seen the other videos and articles and you feel inclined to do so, go ahead and check them out. If you're new to the channel, welcome. I'm very glad that you're here. If you enjoy these videos or articles, consider subscribing to the channel or the newsletter. One day I will, I promise, get around to creating a newsletter, but you might need to give me a nudge. It's not easy to create when you have health issues, ADHD, TBI, and other things going on. Leave a comment with any feedback of how I might make these videos more interesting, or if you would like me to cover a particular topic. So let's dive in. Recap the main points that we've discovered before. Before we begin, we'll refresh. If you have a TBI or someone that you know has a TBI, you'll understand the importance of refreshing the memory. So I know that I do. TBI affects brain function, and it can be caused by head injuries or penetrating wounds. It's a major cause of death and disability that affects people of all ages. Some groups are at a higher risk. Falls, firearm injuries, motor vehicle accidents, and assaults are very common causes of TBI. TBIs can be short-term or long-term, and have implications as such long-term. They can also affect the brain development in children, and it's very crucial to recognize that TBIs in older adults might go unnoticed, especially if they're on blood thinners, but I'll address the topic of blood thinners and older adults as it relates to TBI in a separate video or article. So just refresh on some quick facts about TBI. Affects brain function and can result from a head injury or penetrating wounds. It's a major cause of death and disability, impacting people of all ages. Certain groups are at higher risk. Common causes are fires, firearm injuries, accidents, crashes, and assaults. Various degrees of severity, from mild brain cell dysfunction to a severe unconsciousness or amnesia. Long-term effects on cognitive, physical, and emotional functioning could affect the brain development in children, might be overlooked in adults with taking blood thinners. Understanding TBI is crucial due to its prevalence and its long-term impact on quality of life. And understanding involves exploring different classifications based on the severity and the cause. And TBIs can involve a combination of injuries simultaneously, leading to various outcomes. CDC's got some great information about TBI. So primary versus secondary TBI. When it comes to TBI, there's two main types, primary and secondary. Primary TBI occurs right after a traumatic event, such as a forceful impact to the head. and the immediate damage can have significant impact on the brain and its functions. On the other hand, secondary TBI refers to the damage or damages that can develop and progress over a period of hours or even days after the initial injury. These subsequent damages can be caused by a multitude of factors, including inflammation, reduced oxygen to the brain, increased pressure inside the skull. So it's quite important to try and understand that and distinguish between primary and secondary TBI, as they both play a role in the overall severity and long-term effects. By recognizing and addressing both types of damage, healthcare professionals are able to provide more comprehensive care and support. The causes of secondary TBI, various causes that can contribute to secondary TBI, such as brain swelling, that can happen as a result of an injury when the brain swells and it creates added pressure. As I mentioned earlier, the reduced oxygen flow to the blood, oxygen flow to the brain, and can do a lot of damage. Additionally, trauma can lead to chemical balances changing, having a chemical imbalance in the brain, which can be detrimental to nerve cells, and the chemical changes can potentially cause harm to overall functioning of the brain. Symptoms and diagnosis. Some of the symptoms of secondary TBI, and there are many, they often will mirror those of a primary traumatic brain injury, but they can intensify. Some of the secondary symptoms could include persistent headaches, difficulty concentrating, memory problems, mood swings, or irritability. Medical professionals usually rely on imaging tests such as an MRI or CT scans, as well as monitoring intracranial pressure to diagnose secondary TBI. Treatments and prognosis. The treatment and prognosis for managing secondary TBI involves addressing the underlying causes that contribute to the condition, and that can include the use of medication to reduce brain swelling and manage other symptoms that might be associated. In some severe cases, surgery might be needed to alleviate intracranial pressure and promote healing. Additionally, rehabilitation through physical and cognitive therapies can be beneficial in aiding recovery and restoring functionality. It's important to note the severity of the injury will greatly influence the prognosis for people who've got a secondary TBI. One moment. So, while many people are able to recover from this type of injury, the extent of the damage sustained will significantly play a role in determining what the long-term outcome would be. So it's crucial for patients to receive appropriate medical attention and support throughout their recovery. Some final thoughts. Understanding secondary TBI is crucial, especially for those who believe the journey ends and they're, after recovering from the initial trauma, they think, okay, I'm out of the woods. And that's not always the case. Awareness ensures timely intervention and improves the chances of a full recovery. So this is the end of today's message, just a short one. I hope that you found it informative. Join me again tomorrow and we'll continue learning about secondary brain injury and other brain injury matters and the long-term effects. I hope you enjoyed today's content. If you're new again, thank you. I'm glad you stopped by. It's not easy creating when you've got stuff going on. Let me know what kind of thing you'd like to hear me talk about in the comments. What am I thankful for today? Well, today I'm thankful for my home health aide, Joy. I would forget to take my medications. I'd forget to eat, drink, and do many other things if she didn't remind me. She's a great help, and I am very grateful to have her. What are you grateful for today? Let me know in the comments. Along with any topics that you'd like to see me discuss. As always, thank you very much for watching. Hope you enjoyed today. I'll see you tomorrow. And as always, to remember, please, to take care of your mind. Bye-bye. Love you.